Aversive interventions have been used to treat individuals with varying disabilities and mental illness throughout history. Aversive interventions are defined as any intervention that is applied as a result of a person's behaving in a certain disapproved ways and that is intended to have or has the effect of producing physical or emotional pain or discomfort. According to O'Brien, over time, scientists have used a variety of aversive interventions to address multiple behaviors. These procedures include, but are not limited to, restraints, electric shock therapy, inhaling or ingesting noxious substances, forcing individuals to bathe in cold water, slapping, pulling hair, pinching, exposing individuals to loud noises, etc. Research has indicated that using aversive treatments can have harmful effects both physically and mentally on individuals. Some studies show that using aversive interventions to treat problem behaviors are ineffective and lack merit. Aversive interventions brings up many ethical and legal concerns. Several federal and state laws have been put into effect to ensure the well-being of individuals with disabilities. Also, guidelines and ethical considerations have been implemented to protect the rights of individuals with disabilities. In 1975, Congress passed the Education for All Handicapped Children Act in order to address the public school system's failure to provide adequate educational services to children with disabilities. In 1990, the law was renamed the Individuals with Disabilities Education Act, otherwise known as IDEA. IDEA provides states with funding for special education programs, and in return, states are required to follow certain guidelines and procedures implemented by the Act. IDEA encompasses many guidelines that educational institutions need to follow, particularly standards on discipline. Ordover and Boundy report the various laws protecting students with disabilities place limitations on school officials administering discipline, particularly the circumstances in which students can be excluded unilaterally from their current educational placements through long-term disciplinary suspension or expulsion. Court cases in regard to discipline in schools will be discussed later. Section 504 of the Rehabilitation Act of 1973 is also a federal law that protects the rights of individuals with disabilities. Section 504 is a civil rights decree that prohibits discrimination on the basis of disability. Along with Section 504, the Americans with Disabilities Act of 1990 prohibits discrimination and ensures equal opportunity for persons with disabilities in employment, state and local government services, public accommodations, commercial facilities, and transportations. In 2011, the Keeping All Kids Safe Act was proposed as a way to regulate seclusion and restraints used with children who have disabilities. The Act prohibits the use of seclusion in locked, unattended rooms or enclosures. It prohibits the use of mechanical and physical restraints, and it also prohibits the use of medications to subdue students. The federal laws discussed were implemented as a result of inappropriate treatment of those who have disabilities. These laws ensure the protection of rights and safety of all individuals. There have been several court cases that pertain to aversive interventions used with individuals that have disabilities. The case of Lees versus Kavanaugh in 1987 examined the use of aversive techniques in an institutional setting in Texas. It was determined that behavior modification techniques such as facial screenings were overused and not only risked significant harm but caused it. The treatment of the patients fell well below professional and ethical standards. It was determined that the unacceptable behavior modification programs and aversive techniques violated constitutional, federal statutory, and consent decree standards. James versus Trumbull County Board of Education 1995 alleged that a teacher employed by the school was using aversive interventions to treat problem behaviors among students with disabilities. The aversive treatments including putting hot sauce on a student's tongue to curb the student's pica behavior, along with placing towels over the students' heads and tipping their chairs back while they were strapped to it. The teacher admitted to using hot sauce and was terminated. However, she appealed and was able to get the ruling overturned. In the case of Fee versus Herndon, 1990, parents alleged that the school principal used corporal punishment on their emotionally disturbed sixth-grade daughter who became disruptive during classroom instruction. The claim was that the principal excessively beat the child and that forced her to remain in psychiatric rehab for several months. The court ruled in favor of the principal, stating Texas authorized a reasonable level of corporal punishment to maintain discipline and afforded students post-punishment criminal and civil remedies for exceeding the standard. No substantive due process claim is cognizable. The courts continued to provide a wide range of restrictions in regards to corporal punishment used with individuals that have disabilities. Another case involving the use of aversive interventions was Heidemann versus Rohr in 1996. Parents claim that the school was blanket wrapping their 9-year-old child in attempts to subdue her, which resulted in a violation of her constitutional rights. The court ruled that the defendants were within their qualified immunity because a licensed physical therapist had recommended the use of the technique, and it was not a substantial departure from accepted professional judgment, practice, or standards. One of the most considerable cases that discussed the use of aversive interventions is Wyatt versus Stickney, 1972. The case focused on the use of timeouts, claiming it was an infringement on individuals' rights. The court's decision was that it was a patient's right to be free from isolation. The rule also indicated that a patient should only be placed in timeout in an emergency situation, for example, if the patient is causing harm to himself or others. The decision also composed a set of guidelines that must be followed when putting a patient in timeout, and these include the patient should not be placed in an isolation room for more than an hour before calling a qualified mental health professional. The professional should evaluate the situation that resulted in the patient being placed in timeout. If the professional determines that a continuation of the timeout duration is necessary, then he or she must provide a written rationale for this decision. The written order for continuing timeout stands for a maximum of 24 hours. While the patient is in prolonged timeout period, he or she must be observed a minimum of once every hour, and records of the patient's behavior while in isolation needs to be charted. Over the past decades, several federal laws have been created to protect the rights of individuals with disabilities. Court cases focused on aversive interventions have resulted in laws and guidelines that need to be considered when administering interventions. The oldest documented psychiatric hospital was founded in 1247. According to Rice and Kohler, in 1375, Priory of St. Mary of Bethlehem then became a royal hospital. The hospital was known for its harsh treatment of patients, including whipping, chaining patients to the wall, and dunking them in water. The authors reported that the treatment of patients did not change until the 19th century. This came about because the hospital came under regular government inspection. After 2 inquiries which were severely critical of the system, treatment rather than punishment began. In 1976, Harold Lightenberg published the Handbook of Behavior Modification and Behavior Therapy. Aversive therapy was recommended as a means to treat severe behavior problems. Several researchers discussed using aversive stimuli such as electric shock, noxious substances, and injecting chemicals as interventions to treat obesity, alcoholism, and sexual deviant behavior. In the late 20th century, many advocacy groups such as the American Association on Mentally Retarded, Association for Persons with Handicaps, otherwise known as TASH, and the Council for Exceptional Children called for a change in treatment options for individuals with disabilities. According to her, TASH publicly condemned the use of aversive treatments. Electric shock therapy is considered to be one of the most intrusive aversive procedures used and has gained increased attention over the last few years. It is primarily used to treat self-injurious behavior along with other significant behavior problems. The self-injurious behavior inhibiting system, otherwise known as SIBIS, has been hailed by many professionals as a major breakthrough, resulting in immediate suppression of self-injurious behavior while it is worn. Holden describes the device as a sensor that is attached to the head and triggers an electrical impulse to the individual's arm or leg when SIB occurs. Although some professionals back the device, many oppose it due to the lack of empirical evidence. Many feel the use of SIBIS is a return to the dark past. SIBIS and other methods like it can make patients vulnerable to abuse. Recently, an alternative school in Massachusetts made headlines in regard to the use of aversive procedures on students attending the facility. Judge Rotenberg Educational Center is the only institution in the country that uses electric shock therapy to discipline students. Of the 234 students that attend the school, about half are wired to receive electric shocks. The students are administered shocks for behaviors such as noncompliance, SIB, aggression, and tantrums. According to Persky and Brust, the shocks to the skin surface last about 2 seconds long and feel like a hard pinch, but is otherwise harmless with no side effects. Gonnerman reported that in the school's history, 6 children have died while attending the facility. Massachusetts officials have attempted to close the center down a few times. However, parents and other professionals come to its defense. Several students have spoken out against the treatment they received at the school. This again brings up the question of appropriate treatment and protection of patient rights. Another aversive procedure to treat problem behavior is the use of restraints. Lorman and Zirkle define restraints as any physical technique or mechanical device that restricts a part or the whole body. Examples include physical holds, vests, belts, straps, chairs that tip back, and can include chemical restraints such as sedatives. Westling states restraints had historically been used in psychiatric residential settings, but in recent years have become more commonly used in public schools, particularly with students with emotional or behavior disorders. The authors also note that using restraints was an acceptable intervention in schools to reduce SIB and aggressive behaviors. However, they have been used for less severe behaviors such as running out of the classroom. The use of seclusion and timeouts are another aversive intervention used to treat problem behavior. DeHart defines seclusion as the placement of a patient in a specifically designed room in order to de-escalate behaviors, assure physical safety, and achieve behavioral control. Gaston Nelson defined timeout as the contingent withdrawal of those reinforcing stimuli thought to be maintaining the behavior of interest. Research has indicated that there needs to be specific guidelines in terms of the use of seclusion or timeouts. Gaston Nelson reported that there are several considerations that need to be taken into account when placing an individual in timeout. These include giving an explanation of why they're in timeout, giving a warning signal, having a time limit that should not be excessive, and giving specific requirements for the individual's release from the timeout. Cope and Kasten report that seclusion is used too often and too many individuals are harmed by the use of this technique. In conclusion, there has been a long history of the use of aversive interventions, and there is support from professionals for and against its use. Federal laws such as the Individuals for Disabilities Education Act, Section 504 of the Rehabilitation Act of 1973, the Americans with Disability Act of 1990, and the Keeping All Kids Safe Act have been implemented to protect the rights of individuals who have disabilities. State laws vary on the use of aversive interventions. Some have banned the use of aversive treatments while others support its use. Using aversive interventions brings up several ethical and moral dilemmas. To address these issues, guidelines have been put into place to ensure appropriate practices and conduct. Current research indicates that aversive techniques should be used as a last resort, and specific guidelines and procedures should be followed when they are used. Most research and professionals support using least restrictive measures before resorting to the use of aversive techniques. Non-aversive treatments guarantee the safety of individuals. The debate of whether or not to use aversive interventions has existed for many years. It is concluded that more research studies should be done that look at the efficacy of procedures such as electric shock therapy, use of restraints, and seclusion. Thank you for viewing my presentation.